and I'm the physician assistant here at the Center for New Medicine, and I'd like to welcome all of you to our 13th annual Night of Beauty.
Wow!
So we're so happy to have all of you here tonight. We have our annual presentation, and I'm sure if you guys have, it pretty much hasn't changed from last year. There's not really a lot that we've added or done new this last year. So if you're familiar with it, you can feel free to just purchase your stuff and leave and hang out or do whatever you like. But if you're not sure what everything is on here, then I'm going to explain everything on here tonight. So whatever you purchase tonight will never expire. You can use it at any time. So you can book an appointment anytime in the future. Even like 2 years from now, we have records, so you can always book them. What else do I have to say? So we do offer specials throughout the year. If you're interested in learning about all of our specials, then just talk to my nurse Hannah, who's right over there. Say hi to Hannah. I'm sure a lot of you have talked to her, and you can give her your email information, and we'll send you our monthly newsletter. So it's going to be coming from Brandi M. Nurse, and we only send it out about like once a month. So we're not going to like hit you up every day with any emails. So I'd also like to introduce you to Gita. She is a esthetician who you can book the packages at the bottom. So these are the dermal fusion silk peel packages, the microneedling packages, and the ultravella combination with. And then she also does the all therapy with me as well. Okay. Bonnie is our Revance rep, and she has Daxify and RHA, so she can answer any questions that you have about those products, but she will also be doing a little presentation at the end of my presentation to tell you about the newest neuromodulator that we have, which is Daxi. Yeah. And we also have Deanna and Julie, who are the MERS reps, and they are very knowledgeable about all therapy, Bellatero, Radius, and Xeomin. Okay? And Emily from Eminence, I don't know if she's here, but she's on the other side. And so if you haven't talked to her, you might want to go speak with her about our wonderful organic line of face and body care products. All right. And then I wanted to clarify a few things on this price list. So there are a lot of wrong things. Everything, like pretty much almost everything on the Night of Beauty pricing is right. The Juvederm, the $680 for 2 is not correct. The laser facial rejuvenation, we raised prices this year. So the laser facial rejuvenation, the regular price is now $395. So it's on sale for $295. And all the neuromodulators, we have Daxify, Dysport, Botox, and Xeomin. They're right above the dermal fusion silk packages. So those prices are not right. So Dysport is actually $3.25 a unit. That's our regular price. But 3 units of Dysport is equal to 1 unit of Daxify. So if 1 unit of Botox. So it's pretty much like $9.75 a Botox unit is what Dysport is going for. And then the regular price of Daxify is $8 a unit. 2 units of Daxify is equivalent to 1 unit of Botox. So it's a little bit more expensive, but it lasts longer. Bonnie will tell you about that. Botox, we had to raise our price. And so it's $11 a unit. And Xeomin is now $10 a unit. Okay? And I think that's all the corrections that are on here. All right. And I think we can do one more raffle. So everyone knows that if you Upon entrance, you should have received a raffle ticket. And for every $250 you spend, you'll get an extra raffle ticket. So if you have raffle tickets in your hand and want to put them in here, then go ahead and do that, and we will do another raffle. The more tickets you have, the better chances you win. The prizes get better towards the end.
See, that's the thing now.
Yeah, so you might want to. We'll do more at the end. But yeah, if you want to buy now, you're welcome to, or you can stay and then we'll put like the really good prizes at the end. I don't know, what do you think? Yeah, two bags. And then maybe a biocharger. Let's do a biocharger. Oh, we do have the okay. All right. So right now we have the evidence bag. Therapy bag. Therapy bag.
Therapy.
There's lots of good little things in this beautiful bag. And the winner is Shannon McPhee. You want something? Okay, and then this is for the biocharger. I don't know if anyone's ever tried it, but it's this room that basically like aligns your energy back and clears you of all of your EMFs, which is from your cell phone and all the radio frequency stuff, and kind of can be on different settings to help with anything from cancer to energy. All right, it's really cool. It makes you feel really good. Okay.
It does. It makes you fall asleep. I literally felt so
relaxed.
at peace when I left.
I know. I love that thing. Linda Mullis. Where's Linda? Linda? Oh, maybe she's buying stuff.
I go find her. She was done buying. Okay.
Maybe she left because she knew it. She knows everything.
You have to be present to win.
You do not have to be present to win. So if you leave, we will put your name onto whatever prize you win, and then we will call you. Okay. So we'll get started. So we're going to start with the volumizing fillers. So I like to categorize the fillers. For me, I just split it up into two categories. So one is the volumizing fillers that lift and add volume, and then the other ones are for lines, just for lines and wrinkles. So if you if you have lines above your lip and you don't want to have bigger lips, although I mean really just a little bit of volume goes a long way, if you ask me. But if you just want just to fill in lines and wrinkles, then that's a different type of filler. So we'll talk about that later. So these are our volumizing fillers. We have Radius, Sculptra, Voluma, Jupiter, and Restylane, and RHA. So Radius lasts about 6 to 15 months. We can put Radius almost anywhere. We can't put it in the lips, but we can do Radius for a lot of facial contouring. We can put it in the cheeks. We can put it in the back of the face. It provides a nice lift. We can help with the nasolabials. We can put it in the hands. And you're going to get instant gratification from Radius. It's like one tube of Radius is equivalent to almost 2 or 1.5 tubes of all of the hyaluronic acid fillers. Sculptra lasts about 2 to 5 years. You kind of need to do 2 to 4 treatments in a row though. So the first treatment you're going to get a 20% improvement, which might not be a lot. You're not going to notice a 20% improvement as much. So the more treatments you get, the more volume you're going to get. So you'll get 20% off the 20% after the second treatment.
What are the treatments?
Sculptra?
Yeah.
What is it made out of?
No, I mean it's not.
So it is. No, it's it's a powder we reconstitute. It's made out of dissolvable suture material. It takes about 4 to 6 weeks to see the results
So it's
after each
injectable.
treatment. It's an injectable.
Yeah.
These are all injectable for volume. So it just takes a little bit of time to see improvement. This isn't instant gratification. So But you're going to get a long-lasting effect if you come for like 2 to 3 treatments. So the more treatments you get, the more volume you're going to get.
And doesn't that also build your own collagen?
And yeah, that's why I think it lasts 2 to 5 years, because you're going to build your own collagen. It relies on your body to build your own collagen. And then we have Voluma. Voluma will last around 1 to 2 years. We usually request that you get 2 tubes, 1 in each cheek, and that's where it's indicated for. Juvederm is for like the nasolabial folds and the lips. It's great because it's natural and it moves, but because it moves, it's great just for, mainly for me, I just like getting the nasolabial folds in the lips. It looks very natural.
For what?
And it's instant.
What did you say? Restylane?
Juvederm.
Oh, Juvederm.
Yeah. So Restylane is similar to Juvederm. They're both hyaluronic acid fillers. So Juvederm, Restylane, RHA are all natural hyaluronic acid fillers. Very safe. These are all really safe, but all natural.
How long can they last?
So Restylane will last about 6 to 12 months. Juvederm, supposedly 12 months, but it's really like 6 to 12 months. RHA, well, it's about 12 months. So Restylane, I like putting Restylane everywhere. So we can go under the eyes. They just came out with eye light, which is indicated for, it's a specific indication for under the eyes. We can put it in the nasolabial fold. We can put it in the marionette lines. You're going to get a nice, really good lift with it. It's just a general good all-around filler. And then same with RHA. It will last around 12 months. There's 4 different types of RHA. So there's Redensity, which I call RHA 1, but it's called Redensity. And then there's 2, 3, and 4, and it just kind of goes up in the thickness and the volumizing. So for the volumizing fillers, we use RHA 3 and 4. And Redensity might not be on there, but just check RHA. They're all the same price.
Brandi, this addresses the safety of Sculptra and Radius as compared to hyaluronic.
So, I think all of them are safe. The way that Sculptra's evolved is that we used to put just like a little bit amount of water in it. So most of everything comes, like Sculptra comes in a powder, actually. That's actually the only one of these fillers that do. And so we can kind of dilute it to a certain extent. And so now we haven't gotten any problems with it. We just can't put things that are not hyaluronic acid in lips because it can cause little nodules.
It can cause what?
Little nodules. Yeah.
You mean that, but not in Sculptra?
Sculptra can. It's.
Can it?
Yeah, they all can. Even the RHA and the Juvederm and Restylane, they can all cause nodules, but they're less. The HA fillers are less likely to. But I don't usually get nodules.
When you say nodules, though, what does that mean? Just spiritual
You can
lump?
feel it. Sometimes you can feel a lump. You can't necessarily see it. If you do get a lump with the HA fillers, we can always take it out. But it's going to take out all your hyaluronic acid in your face, pretty much. Wherever we inject it, it's going to take out that whole area. Sculptra and Radius, it's a little bit more difficult to take out. We put the dissolvable hyaluronidase in there, but we also might have to inject a little bit of cortisone to try to get rid of the
So you don't
nodules.
put water in anymore, basically.
In Sculptra? To dissolve Sculptra, yeah. So I usually mix Sculptra with a total of 10 cc's, like 8 cc's of lidocaine with, or 2 cc's of lidocaine with 8 cc's of water. So you're less likely to get nodules, but in certain areas you can. So we don't always put Sculptra in certain areas.
What do you think is good for the, temples?
Well, Sculptra is good and Voluma is good for temples. Those are the 2 that I would recommend. So these are just some before and after pictures. We can go through these real quick. So this is Radius before and after. You can see a nice lift in the cheeks. She had that cheek line that when your cheek splits and starts to fall, this is very common. And so it fills nicely with radius. This is radius in the hands. We can also put hyaluronic acid fillers in the hands as well. This is Sculptra after 2 treatments, 2 tubes of Sculptra. You can see a nice lift and volume. You know, it did quite a bit to fill her face up and just make it look more youthful. And this is Sculptra just in the cheeks. And you can see the marionette lines, the nasolabial folds, like the neck. It just kind of lifted everything. We didn't put it in her neck. Not that time, we did it at another time, but we didn't put it in that time. So this is Voluma, 2 tubes just in the cheeks. And it's just natural. You can see a nice natural lift, and the nasolabial folds kind of dissolve and look a lot better, and just everything just looks more lifted and natural. So this is Juvederm in the lips. And we can do lips however you want to do lips. So this might be 2 tubes of filler. We can do less, but people come in with pictures, and I always say, if you want your lips done, come out of the picture, let me know what you want your lips to look like, and we can do that. I love lips. Totally takes away aging. So this is Kiss, Wrestle and Kiss in the lips, with just 1 tube. Nice natural look. So these are our fillers for lines and wrinkles. So we have Bellatero, which lasts about 6 to 12 months. We have Volbella, which lasts around 12 months. And then we have RHA, which also lasts around 12 months. And the RHA for this would be the Redensity, and then the RHA2. So you can see we put Bellatero in her cheeks with just to soften the wrinkles, and then in the lips, in the lip lines. So no filler is going to make all your lip lines go away. Like if I do that, that's amazing for me. But it usually doesn't happen. It usually just softens everything. And then this is RHA. I believe we put 2 and 3 in. So the top pictures are the before pictures, and the bottom pictures are the after pictures. And you can see a nice, like, basically the wrinkles have softened significantly, and you know, even there was lots of like little fine lines and wrinkles in the cheeks, and we filled all those in, and everything looks nice and smooth. And this is in the cheek. A lot of people do lose volume. This is more excessive, but we filled that with RHA. And now when she smiles, you can't really tell that it's in there. If we put Restylane or Juvederm, it just doesn't stretch as much. RHA will give you more stretch and more natural. It's a dynamic wrinkle stabilizer. Yeah.
Which RHA did you
Super duper.
I think that we started with 4, then went to 3, then went to 2, and this was not yet with Redensity. Redensity wasn't out yet, but we did put it in. So this is the same before and after. Which I think all right, laser. So we have our laser. This is my favorite laser. This is like my baby. It's a KTP green light laser, and it does so when you do lasers, you do the opposite color to cancel it out. So the KTP helps with reds and browns. So this is for the brown spot. The other one was for the reds, and this was just after 1 treatment. And it evens out your skin tones, and
Brandi, does that care for the little broken blood vessels?
Yes, all or anything red, any like broken blood vessels, rosacea. I'll help with all of that.
Exactly.
So, oh, sorry. With that, we usually recommend. This is after one treatment. This is I think after 3. So we usually recommend 3 treatments with this, like 1 to 2 months apart during the winter. You have
That's
to.
a very light. It's not what I'm getting.
It's gonna make your brown spots dark and scabby for 7 to 10 days, and then they'll fall off.
That's all I get.
And then we recommend that you kind of just maintain and do a follow-up like once a year.
So this is not like a CO2?
This isn't a CO2. You're not gonna get red and peel. You're just gonna get rid of the browns and reds. Just light. You might like have a light peeling on the reds and browns, basically. So PRP. So PRP is a therapy that uses the patient's own blood to regenerate damaged tissues. We can make an injectable. PRP is rich in growth factors that are activated with calcium citrate, vitamin C, and ozone. The growth factors stimulate cell proliferation, which slow down as the skin ages and promotes the growth of collagen and elastin. So, let's see. I have this on the next page. So we can inject PRP into the scalp for hair loss. Oh yeah. We have a specific centrifuge with our PRP. It's pretty specific. It's pretty slow, and it'll separate out your stem cells. So with our centrifuge, we can see how many stem cells you have. We can see if it's a good blood draw. Wow. We usually recommend, if you do choose PRP, that you don't eat fat that day because it makes the blood cloudy and it's harder to see the stem cells and get them out. So usually low fat the night before and the same day, and then alcohol and drugs will take out your stem cells, and I won't get any if you do that.
Do you do PRF? Do you do it
So-
with fibrin? Do you do that?
I was just looking that up actually because I knew someone was going to ask that question. So I'm not really
Can you talk
sure.
about that?
It's a gel. It's like a
It's
when
an
you
easy
make
gel.
it.
Yeah.
Yeah, you make it. It makes
good
it
for-
more like a. It seems like it's more like a filler kind of thing. Gel-like
Yeah.
substance. It makes this gel-like
Really goes
substance.
underneath the eye.
Yeah.
It's like a serum.
I was looking at it, and they can make this jelly-like thing. I don't know.
Yeah, you have to have a guinea pig there.
Yeah, so I'm not sure how they like. I know it's brand new for me. I've been looking it up and kind of doing some research on it, so maybe we'll incorporate that. But our machine is amazing. Like when you see our before and afters, it's like ridiculously amazing. What microneedling with your own blood does.
So that's good for like the hollow line underneath the eye, correct? You could do that for that.
You can do it, but I mean, the best thing for that is still Restylane.
Restylane.
Yeah. Yeah. But we can make an injectable gel with a similar consistency to other fillers and inject it in the face, but I've just found that it doesn't work as well. So we usually recommend that you combine it with one of the hyaluronic acid fillers, like Restylane, Juvederm, or RHA, and we just mix it all together, and we can put like a lot of it in your face, and it looks really good.
So Brandi, when you do the microneedling and the PRP, it's microneedling and then the PRP is just
Yeah.
applied to the skin?
Yeah, we put it inside the microneedle and just microneedle it over your skin. So that's different than the microneedling package. So what I do is the PRP with the Dermapen. So it's a little bit different. I go deep. So when I do it, I'm doing medically grade, like it's going like 2 millimeters in. So we're going a lot deeper, so you're gonna get a little bit of a better effect with your own blood too. So, and that's the microneedling. And we can also put it in joints. And it works really well. So we usually recommend 3 to 6 treatments for successful results. There's 1 to 4 days of downtime with redness and swelling initially, and within 2 to 4 days the skin may peel. It's safe on all skin types. So the 1 to 4 days of downtime is usually just after the first treatment. Subsequent treatments, you're only going to get red for about 24 hours. There's not going to be really any peeling, and you're just gonna heal. It's gonna lift. It's gonna get rid of scarring. It's pretty amazing. So this is PRP after 2 treatments. I don't know if you can see it as well on that, but I can see the one here. But there was a lot of scarring and a lot of active acne, and after 2 treatments, the acne has pretty much resolved itself, and the scarring and the pitting have significantly decreased.
And that's with microneedling?
That's with microneedling and PRP. And this is the same thing. She had so much acne, PCOS, like polycystic ovarian syndrome, like just a bunch of stuff going on her face with acne and acne scarring. And you can tell that after, I think we did 2 treatments on her too. I mean, even her neck is lifted. Oh, I have a pointer. Hey. That's nice. Okay, so these are the befores and these are the afters. And this slide I've shown for a while. So this lady, 5 years later, so she would do it just once a year for 5 years, and she looks younger after 5 years than she did when she first started. And she had a lot of scarring, and it just kind of lifts and shrinks the pores and gets rid of the scars.
So you have to do it yearly?
You don't have to. I mean, she had major scarring and major pitting. So she would just come in once a year. She didn't, I don't know if she did, she might have done 3 initial and then this would come in once a year. She doesn't do that anymore. I think now she comes in for all therapy.
So is that the combo of the microneedling with the PRP?
Yeah.
So there's like you're getting like 4 treatments?
Yeah, I mean, usually between 3 and 6 treatments.
Okay.
But I mean, you can see, this is, okay, here, I think this might be the next one. This is just after 1 treatment.
Wow.
Yeah, so this was just 1 treatment after PRP in someone older.
Is the PRP and the microneedling together, or are they?
Yes. So we have to draw your blood, and then we have to process your blood. So that's going to take like an hour and a half. So you need a lot, about 2 hours. So while we're drawing your blood, you're going to numb for an hour, and then we microneedle. She had the exosomes put in too. So as you get older, you're going to lose your stem cells. So sometimes I'm amazed, and you're older, and we have great stem cells, but it doesn't happen as much, and the stem cell quality might be not as good. So I can see a good amount of stem cells, but the quality might not be as good. So so she had the I think it was just the Benev exosomes put in, and had like an amazing result.
Does that kind of give your face a glow?
Yeah. Yeah. So let me go back. So see, her face is like glowing. It's just the light is shining in the right places. It's not just kind of splattered on her face. You can see just 1 treatment. So this is PRP in the hair. You can, and I think this was 3 treatments. 3 treatments.
Yeah.
A lot of hair growth. Oops. So that we just basically take your blood, spin it, get the stem cells, get the PRP, and then just inject it in. So there's not microneedling.
And you said you go pretty deep with the PRP?
So when we're using PRP with the microneedle, I go 2 millimeters. So it's not really deep, but it's deep enough to help with scars.
How long does it last?
The hair?
The hair.
I mean, I would say you want to do like 3 treatments in a row, and then usually people come back every 6 to 12 months for just, and I would say actually more like 12, because people they travel, they move,
Yeah.
so they come back just once a year.
You know, is that, in that second picture, is that the top of his scalp?
Yeah, that's like
Bald?
this area here that was all falling out. And you can see all the hair growth coming in.
But how about if you have thinning on the entire head? Well, how many treatments or vials would it take?
I mean, we usually say 3 treatments, and usually we make you pick. So if you want this whole area here, we can do this whole area here and the back of the head. I mean, usually people don't lose the hair in the far back. That's not usually where you lose it. So we can put it here and we can put it over here.
You only lose it where you can't see it. Right here.
Yeah, so we can go all the way back.
Right.
So exosomes. So what are exosomes? They are the signaling part of a cell. When injected or placed in a certain area with a matrix such as PRP, they will mainly stay in that area to help tissues to heal and rejuvenate. We can combine exosomes with PRP or hyaluronic acid and other growth factors to achieve a more successful result in anti-aging, hair growth, and skin rejuvenation. There's no DNA in exosomes. There's no risk of rejection. So the exosomes can't really cause cancer because they don't replicate. And it can be used to treat other chronic conditions like eczema and dermatitis. So we have 2 types of exosomes in this clinic. The first one is the Benev exosomes, and it comes with like a hyaluronic acid and a bunch of different growth factors and peptides and vitamins and minerals. So we can mix those together. So if you choose not to do your own blood, we can just mix those 2 together and microneedle it in with a great result, like you saw in that lady. So these exosomes are derived from fat cells from different donors in their teens and early 20s. The exosomes are sterilized and lyophilized or freeze-dried, so it's safe and effective. We talked about the regenerative complex. There's over 5 billion exosomes for the skin and scalp rejuvenation per vial. And if you want more information, you can go to benev.com/exosomes. And then the second are the chimera exosomes. So these use the mesenchymal stem cells from a single donor's placental cells, like this was from like pre-COVID, one donor, and then they continue to use that donor's exosomes and multiply them. So they've been proven safe and effective with numerous studies. It's safe for injection into any area of the body. So this is where we put injections into joints. We use chimera exosomes to help rejuvenate the different types of tissue. And if you need more information, you can go to chimeralabs.com.
So is that for when people are having, they say, oh, we have to do a surgery on your knees? That helps it from preventing.
We can try to prevent them. I mean, if you need a knee replacement, probably not happening. If you tore a meniscus, yes, it can help heal. If you sprain things or if you have arthritis, this helps a lot. Very significant.
Do you use ultrasound if you're injecting a joint to visualize?
I don't. But I usually go into the joint, but there's other areas usually affected. So when you just use an ultrasound, you're just going to go into the joint. Like I don't see a lot of like a great response. You also need to like inject other areas. Like if you have a bicep tendon, if you have a tricep tendon, like wherever your areas of tenderness are, we also go into there. Because there's different areas of the bicep tendon too. You know, I mean, so we get really good results with it. Yeah.
Did you say these were taken pre-COVID?
Yeah. 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 So there's no weird stuff in there. Yeah, basically.
What are you talking about? That's what she's saying. Sorry, I'm lost. Are you talking about?
This lady, it was from a pregnant lady. They took her umbilical cord or placenta, the amniotic fluid, and they derived the exosomes from there, and then they keep deriving the exosomes from that one donor. So she's been vetted. We know she's safe. It's been used for years and years. So very safe exosomes. That's the price difference. There's a big price difference between the Benev and the Chimera because of that.
She's a donor, though. Like.
Yeah, so she donated, and then they made sure she was perfectly safe, and then they took that, and then from there.
So, Brandi, it's like your sourdough starter.
Yeah, it's like your sourdough starter.
I've never made sourdough, but yeah. Okay, so sclerotherapy, we can use it for the treatment of spider veins and varicose veins. In our clinic, we use the sclera, which is polydocanol, as the injectable. It's a procedure in which the red and green veins are injected with a detergent-like substance, which acts to irritate and subsequently collapse the veins. We usually recommend 2 to 3 treatments for pretty much complete resolution. But it's just like anything else. You get rid of your veins and you end up, as you age, you just get more veins. So it's always, everything in life, if you want to do anti-aging, is maintenance.
Yeah.
This is before and after. Ultherapy. Ultherapy is the only FDA-cleared non-invasive procedure that lifts and tightens the neck, chin, brow, and improves lines and wrinkles on the chest. There is no downtime. Ultherapy does not affect the top layer of the skin, so it can be used during any time of the year, including summer. It's safe on all skin types. It doesn't affect the layer of the skin with pigmentation, so we can use it on all types of skin. The length of time depends on the area being treated. Usually we recommend 1.5 to 2 hours for a full face and neck treatment with 1 hour prior of topical numbing. So if you come here, a lot between 2.5 to 3 hours of being here. But if you don't have that time, you can split up the procedure and have it done at different times.
Are you using radio frequency or?
No, this is just ultrasound. So it's
Okay.
just ultrasound, and it targets different layers of the skin. So we go like 4.5 millimeters, 3 millimeters, 1.5 millimeters. And they're back there if you have any technical questions, Deanna can answer them. So before and after pictures are absolutely necessary. Take your own, and we can take them as well, because the results take between 3 to 6 months to see. So when you do the Ultherapy, you're gonna look at yourself in the mirror every day. You're not gonna notice anything improving. So you're gonna have to look at what you look like before and then what you look like in 6 months.
So are you heating up the proteins with the ultrasound? With the shrink?
You're heating up the collagen, and you're causing injury to the areas that we're going, like micro-injury. And then because of the micro-injury, your collagen gets stimulated.
How about the circulation in there? Are they going to decrease it a lot? Or?
No, it won't decrease it.
I'm thinking about the capillary shrinking too.
So, no, you're not going to get capillary shrinkage, I don't think.
She wanted to answer questions if they had any questions.
Yeah, do you have questions? Any other questions? But if you have any, that's Deanna.
Okay.
And she is our Ultherapy rep.
And she's good. She knows that.
Oh, she knows all the answers to everything Ultherapy.
Thank you. That's all.
So we have a lot of before and afters, and these are all after just pretty much one treatment. Some people have multiple, but this was after one treatment. And you can see.
Full face, Brandi, or those neck?
This was full face and half the neck. So you can see just like she had like this little turkey neck, and it's gone. Pretty much gone. But this is also maintenance. So every 1.5 years, come back and see us. We have multiple returners. Like people come, they love it. This is in the upper face. So you can see a lift in the eyebrows, and the wrinkles have significantly decreased. And I think after the first one, like she had come in for Botox the second time. So there was no Botox in her face on the after picture. Nice lift here in the neck and the cheeks. So I think this patient had about 2 treatments afterwards, but look at her neck. I mean, you can see really like she didn't have a neck, and it's significantly lifted. The neck looks a lot better. A lot of lift, a lot of collagen stimulation.
No, it's really good.
So UltraShape. UltraShape is a non-invasive in-office ultrasound device that is usually virtually painless and is used to permanently reduce fat cells in the circumference of the area treated. In a clinical study, UltraShape Power showed a 32% reduction in abdominal fat layer thickness. On average, a person will lose 3 to 6 centimeters after 3 treatments spaced 2 to 4 weeks apart. We can combine UltraShape with VelaShape to further lift and tighten the treatment area. VelaShape uses radio frequency heat and infrared light to achieve results. So tonight, this special is correct. So this is a really good special for UltraShape. So it's $1,500 for 3 treatments, and we have UltraShape and VelaShape combination with it. Really, really good.
Where is that?
So it is in like the third from the bottom.
Oh. Oh, I can go up and
Yeah, really good. So the thing with UltraShape is it's going to get your fat, on the top. It's not going to get your visceral fat. So if you have like a tummy that you can't pinch inches on, and it's just kind of bloated, you're not going to get as good of a result. So, but there's lots of good results from it even. So these are before and afters. We got lots of them now. Good results. InstaLift. So this is what InstaLift looks like when you're getting the procedure done.
Is that the threads?
Yeah. So this is the thread lift. So it's a non-surgical, simple in-office procedure that takes between 60 and 90 minutes. It is made of dissolvable suture material called polylactic acid, or PLA. This is a sculpture material. The threads last up to 18 months on average, but because it stimulates collagen, the results can last for 3 years or longer. Post-procedure side effects include skin puckering, bruising, soreness, swelling, numbness, and infection. So I can say now we've been doing InstaLift for 3 years or so, and we've been getting really good results. We have a lot of people returning. So it's nice to see like people coming back after a year to get a couple more threads put in. The discomfort is pretty minimal. And then after like 2 years now, I'm seeing patients back to get a whole nother treatment. So it's lasting a good long time. So those are some before and afters with InstaLift. Okay, and last but not least, we have Daxify. So Bonnie will be talking about Daxify. Just to remind you, 2 units of Daxify is equivalent to 1 unit of Botox. And it's our newest neuromodulator.
Thank you.